but I feel hungry and exhausted.
Oh, why?
Because I'm preparing a medical checkup tomorrow.
Uh-huh. Oh.
Yeah,
Mm-hmm.
and then I get uh intestine checkup
Oh.
by
Okay.
some scope,
Uh-huh.
internal
Yes.
scope. Yeah,
Yes. Do you know how that goes?
yeah. Have you ever experienced that?
Oh no, I haven't. Okay, but I've seen and I have assisted.
Ah,
Yes. Um. Yes. It's
it's a
kind
very
of.
hard process.
It's embarrassing, actually.
Yeah, actually not embarrassing. It's just hard processing. I have to drink lots of water with some medicine to clean up
Mhm.
my intestine.
Mhm.
And then, yeah, it actually takes several hours.
Yes.
Yeah, I
Okay.
feel now, yeah, it's
So
just,
actually, they will put uh, what do you call that? I actually forgot. It's like a hose, okay?
yeah, kind of a scope
Yes,
with a
with a
camera.
camera, and
Yes,
then they're
right.
gonna insert it.
Yeah.
Yes, so it's embarrassing. Okay. Um, it was for my patient before. When
Yeah.
I assisted in that kind of procedure, my patient was really embarrassed.
Oh,
Okay, but it was for a good cause, right?
yeah. But in my case, I take some medicine, so I
Mhm.
couldn't recognize that. I just fell asleep.
Mhm.
Uh, propofol,
Yes.
they make me sleep during the
Mhm.
time.
They will make you sleep,
Yeah,
right?
they will make me sleep. Yeah.
Mhm. Yes. Okay. So why do you have to undergo that kind of like procedure?
Because of to check up of intestine cancer.
Ah,
It's the best way to check up
to
because
check.
last checkup, doctor found two polyps on my intestine. Then it's a
Mhm.
kind of seed of cancer.
Yes.
So he removed that, and then he told me I have to check up every year for
Mhm.
several years.
Mhm. Mm. Okay. So yes, you have to get a checkup every year, right?
Yeah.
But I heard that it's an expensive procedure, right?
Yeah, but thanks for my company. It's free for me. The
Mhm.
company, yeah, support their all expense.
Oh, so they're gonna pay for it, right?
Yeah,
Wow. That's good.
yeah,
Okay, I'm
it's good.
very happy for you, and I hope that it will not turn bad. Okay? Yes. I hope that it will have a good effect. Okay?
Yeah. So, do you have nurse license?
License, yes, I do.
Oh, why lots of Filipina have license of nurse?
Okay, because here in the Philippines, a long, long time ago, well, not really a long, long time ago, but maybe 10 years ago,
Yeah,
10 years ago, the most popular major, okay,
yeah.
or the most popular profession would be nursing. Because
Oh,
there are a lot of countries,
yeah,
like the United States, the
yeah.
Middle East, the United Kingdom, and other countries from the
Ah,
West that
yeah.
accept Filipino nurses.
Mm.
Yes, because they said that Filipino nurses are actually one of the best.
Then if you work at that country, you get a visa
In the
or green
Philippines?
card.
No. So you have to work, okay, because in different countries, like maybe, let's say for
Yeah,
the United Kingdom, you have
yeah.
to at least have 5 years experience in
Oh,
the hospital, okay? You have
yeah,
to have at least 5 years experience in the hospital,
yeah.
and you can work. abroad. You have to apply, okay? It
Mm,
also depends if you are legible to work abroad, okay, or if you can be accepted to
yeah,
work abroad. But there are cases, okay, um, like Saudi Arabia,
yeah.
they accept, how do you call this? They accept fresh graduates. Yes,
Graduate?
yes, fresh graduates
Yeah.
from the university. But if you
Uh,
are going to work here in the
yeah.
Philippines as a nurse, it's not good.
Uh,
Yes.
just like Korean, about 30
Mhm.
years ago,
Mhm.
actually, lots of Korean nurses worked in German.
Mhm. Oh, really?
Yeah, worked in Germany.
Mhm.
Yeah, and you, lots of males worked as a minor.
Mhm.
Yeah,
Oh,
and
really?
so they get a lots of dollars
Mhm.
from there, and that's the seed money for Korea's developing
Mhm.
development.
Development.
Yeah.
Um. Wow. Okay. So what happened now?
What happened now?
Yes.
Actually, lots of nurses want to work in America and they try to get IH, good
Mhm.
score.
Mhm.
Uh, because in Korea, nurse is a kind of a 3D job.
What do you mean?
3D job means stand for dangerous, difficult,
Oh,
dirty.
really?
Yeah, actually, nursing is a very difficult job.
Uh huh.
It's a, they have to work on shift time. Sometimes they have to work overnight.
Uh huh.
And actually, overnight working is very unhealthy for human's health.
Uh huh.
So mm, many people don't work as a nurse in Korea, but if they
Mhm.
work in America, they get a high salary and enough
Mhm.
free time,
Mhm.
and even they get green card.
Oh, okay. So are there also male nurses in Korea?
But that's a very rare case.
Uh huh. Okay.
Yeah,
Really?
yeah.
Why? Why is it a rare case?
Because we Korean think nurse
Mhm.
is just women's job, not a
Uh
man's
huh.
job.
Uh huh.
Only mental hospital or something like that.
Uh
They
huh.
need men's men's men. They use uh, male male nurse.
Uh huh.
So the rate is less than 5%.
Uh huh. Oh. Okay. Really?
Yeah,
Okay. So it's less than 5%, right?
yeah.
Oh. Okay. So how about you? Have you ever thought of like maybe working as a nurse before?
Oh yes, of course. Because uh, I served the army as a medic.
Oh, a medic.
It's a
That's
kind of
amazing.
a male nurse.
Uh huh.
So I don't know why, but I chosen as a medic.
Uh huh.
I don't have any background or study background or school background that
Mhm.
related to nursing or taking care of a patient. But
Mhm.
I get picked as a medic, and I was trained for 6 weeks
Mhm.
how to care patients and how to inject.
Oh.
Yeah, and
Okay.
then yeah, I served 2 years as a medic.
Mhm. Mhm.
So think I was a good medic, and if that if that was my job, then I must be satisfied with my
Mhm.
job.
Mhm. Oh, you want to be satisfied, right?
Yeah.
Okay, very good. So in the future, okay, would you want to, or do you think that in Korea there would be more male nurses or not?
The demand for male nurses is getting high,
Uh
and
huh.
also lots of lots of young young guys want to be a nurse
Uh huh.
because of unstable uh, unstable financial situation,
Mhm.
and then getting a decent job. The chance of getting a decent job is low,
Uh huh.
and then yeah, nursing is a kind of a stable job,
Mhm.
even though it's a difficult job, but they don't need to worry about get fired or get lay off in
Uh
early
huh.
age.
Really?
Yeah,
Oh.
because
Okay.
of yeah demand and supply is not matched yet.
Uh huh.
There are lots of demand
There are lots
for
of demands, right?
yeah male nurse.
Uh huh. Wow. Really?
Yeah,
Oh, that's nice, right?
yeah.
Okay. But do you think that there are people who are kind of like embarrassed to become nurses?
Yes, yeah. Maybe many many people, many male, I mean many guys think about that. If I if I'm a nurse, I feel some yeah shame on that in front of my future fiance or parents-in-law or my relatives.
Mhm.
But when I when I watched the interview of a male nurse on the TV or on the magazine, uh,
Mhm.
many of them are proud of their job, and then
Mhm.
they are satisfied of their benefit as a
Mhm.
nurse.
Okay, they're satisfied, right?
Yeah.
Oh. Okay. Well, as long as they are satisfied, right?
Pardon?
Yes. How about yeah, you. Have you ever thought of like maybe becoming a nurse before?
Under what?
Did you want to become a nurse before?
Yeah, yeah.
You did, right?
But I'd rather be a doctor, not a nurse.
A doctor.
Yeah.
Okay. Why a doctor?
A doctor is getting more money
Uh-huh.
than working as a nurse,
Uh-huh.
and then it's still popular job in Korea, and lots of women want to get married with doctors.
Uh-huh. Oh. Oh, really?
Yeah.
Okay,
And
that surprised me.
are they in
Why?
your country?
Well, not really.
Not really.
Yes.
They don't get lots of money in
Oh,
Philippines.
they do. They do get a
They
lot of
do.
money here
Yeah.
in the Philippines,
But
but
not a
they're
popular
very
job.
busy.
Ah, yes.
It is also a popular job, but it
Yeah.
is very expensive.
Mm.
Yes, it is very expensive here in the Philippines.
Then what about you?
Me?
When when you work when you worked as a nurse,
Mhm.
there are lots of doctors around you and
Yeah.
who want to go out with you.
Oh no.
Oh,
They
really?
were old, okay? They were old. Yes.
Oh,
Yes. I think that they were pretty old.
pretty old.
Yes, yes, they were old for me.
There was
Okay.
no young doctors around you.
No, no.
Oh,
Yes. And somehow I think that they are kind of like, um, how do I say it? I mean, they are nice. They are nice, okay? But
yeah.
when I was working in the hospital, they were kind of like snobbish, okay?
Oh,
They ignore you,
oh,
right? Because
yeah.
they think that they are better than you. That's the
Yeah,
most
yeah, yeah,
annoying
yeah, yeah.
part
They
about doctors.
yes, lots of them are arrogant and they think they are superior than nurses or patients.
Yes.
Yeah,
Yes,
but
it is very bad, right?
yeah. But in
Yes.
Korea, there are lots of doctor and nurse couples
Mhm.
because they in same work in same place,
Mhm.
and they could make some relationship.
Mhm.
And then I don't know why the nurses in the big hospital are usually beautiful.
Mhm.
The big hospital choose beautiful nurse,
Mhm.
right?
Yes, I
Yes.
think. No.
You think?
No. I
Why?
don't
Is there
um
any reason?
because here in the Philippines, looks compared to Korea,
Yeah.
looks does not matter.
Ah,
Okay? So, Filipinos focus more on like the skill of the person.
yeah.
Yes. What do you think about that? Is it the same in Korea or different?
Um, when I was a university student, I met several nurses and several several girlfriends who study
Mhm.
in nurse.
Mhm.
And then they sometimes they complained about their their schools.
Mhm.
Their some of their friends get in the big hospital, even though their score
Mhm.
their school score is low. But if they are beautiful, if they were
Mhm.
beautiful, they could
Okay.
easily get a good job in the big hospital.
Oh, really?
Yeah.
Isn't that unfair?
Yes, of course, they said. But as
Oh.
your patient, then it could be more effective. Get a
Mhm.
get get treatment by beautiful nurse is
Mhm.
more. I think it's more effective.
Mhm. Oh, it is more effective, right?
Yeah.
Oh. But what's annoying, okay, I'm not saying that I'm beautiful, okay? I
Yeah.
am not saying that I am beautiful, but there was this one time I took care of a fellow nurse.
Yeah.
He got into an accident
Yeah.
and then he was placed in my ward, okay?
Yeah.
So I was really annoyed because I was like trying to clean him up by
Yeah.
like cleaning or wiping his face with
Yeah. Yeah.
um a towel, a wet
Yeah.
towel, and then he suddenly grabbed my hand.
Oh.
Yeah, so he grabbed my hand. I was very surprised. I didn't know what to do. So he started cleaning his face
Yeah.
on his own with my hands there. So I just pulled my hands away and then I walked out. I was annoyed. I was
Oh.
really, really annoyed. It was kind of bad.
Yeah.
Yes.
What did he say to you? He
Nothing.
didn't mention anything.
He did not
Nothing.
even say I'm sorry. He did not say
Oh.
thank you. I was seriously um like harassed. I felt
Yeah.
harassed during that time.
Yeah. Yeah.
Eh,
That's kind of harassment.
Yeah, it is, right?
Yeah.
Yes.
But yeah, in my case,
Mhm.
when I was young, I got
Oh, racist.
braces. So I
Uh-huh.
had to go dental once a
The
week.
dentist.
Yeah,
Uh-huh.
dentist once a week, and it's a very difficult and painful uh, treatment every
Uh-huh.
time. But if the beautiful nurse took care of me, the pain is not very severe.
Uh-huh. Oh, really?
Yeah, yeah.
Okay.
So I think it's very effective.
It was very effective for you,
Yeah.
right?
Uh,
Okay. So do you think that like a beautiful nurse will assist you tomorrow?
Tomorrow,
Yeah.
I'm not sure, but
You're not sure.
I get sleep during the time, so I
Mm-hmm.
couldn't remember anything.
Oh, but won't you feel a little embarrassed?
No, no embarrassed.
You will not feel embarrassed,
Why?
right?
It's just yeah, it's just medical checkup.
Uh-huh.
Not any yeah, not any. I don't think there is no shame, nothing to shame about that.
Nothing to be
Yeah,
ashamed
nothing to be
about.
ashamed about that.
Uh-huh. Oh, okay. Well, as long as you are not embarrassed, okay?
Yeah,
Yes. Okay.
but
So,
yeah, shame thing.
mm-hmm. Me?
I know in
Yeah,
my
I
life.
would.
You really?
No, no, no. I
But
mean, if I was the nurse, I won't be
yeah,
embarrassed, okay? I won't be embarrassed to assist the patient. But if
yeah,
I was the patient and, like, the doctor is really handsome, I think
yeah,
I would be embarrassed because he will see, yeah, that private area, right?
yeah, yeah.
Yes. So I think that it's, yeah, it would be kind of like a little embarrassing for me.
Little, yeah.
Yes. Especially if the doctor is really good looking, right? I
Only
can't
when
imagine.
when the doctor is yeah handsome guy, you
Mhm.
feel shame.
Yeah, of course, right? I think it's kind of embarrassing, but I just hope that somehow it won't be very. Yeah, I hope that it won't happen to me. Yes. So if ever I go for a checkup, I always
Yeah,
check if the doctor is handsome or not.
yeah.
Yes.
But yeah, lots of women, lots of girls suffer from hemorrhoid.
Ah, yeah, yeah.
So yeah, when they go to the hospital to get rid of that or check up that,
Mhm.
yeah, don't you feel shame on that?
No, I don't because I'm not the patient. Yes. If I were the patient, of course, I would be ashamed or embarrassed. But
Yeah.
if I am just there as like a professional nurse, then it's okay.
Mm,
Yes. There was this case when
yeah.
I was in the delivery room.
Yeah.
I was annoyed with a girl.
Yeah.
She was 18 years old and
Yeah.
she was about to give birth.
Oh.
Yes. And she didn't want to like properly take out the baby
Yeah.
because she was suffering from hemorrhoids
Oh.
and it was very painful according to
Yeah. Yeah.
her. Her
Yeah.
hemorrhoids was very painful, but the baby was already in distress.
Oh.
Yes. So she only cared about her pain in her hemorrhoids, okay?
Yeah.
And she didn't care about the baby. It was like really annoying.
Oh. So what
Yes.
happened to her?
Well, she eventually gave birth, but the doctors were really mad at her. They were
Yeah.
really annoyed with her
Oh.
because of how she acted. Yes. And they told her that you are just 18 years old and yet you're already a mother,
Yeah. But
right?
I heard.
It's normal here in the Philippines.
Yeah.
Yes.
I heard that.
Yes, it is. It is very normal here in the Philippines. Actually, my sisters, I have two sisters,
Yeah.
and they both have children already. One
Mm.
got pregnant at 17. The other
17.
got pregnant at the age of 16, I think.
16.
Yeah, and I don't have children yet.
Yeah. But you have a boyfriend.
Yeah, I do have a boyfriend, but I don't have children yet. I have
Oh,
dogs, lots and lots
oh,
of dogs.
yes. Yeah, good for you. So yeah, you are very cautious on that, not to get pregnant. Yeah.
Yes, yes.
Uh,
And actually, both of them have six, I mean, three babies each.
three babies now?
Yes, three
Uh,
children
and
each.
both of them get married?
Yes,
Oh, good for them.
yes. I mean, it's nice, right? But I think that somehow they were not able to enjoy their youth because they
Yes, right.
became mother at a very early age. But for me, I am
Yeah.
enjoying myself because
Yes, right.
I am
You
now
are so
married.
wise.
Yes, exactly. And actually, at the age of 22,
Yeah,
when I was 22 years old,
yeah.
my grandmother was already worried. She said that
Ah,
I might not get married. She wanted me to get married at the age of 22, but now I am 28 years old and I
yeah.
am still not
Yeah, it's
married, right?
okay. Until 33.
Yes, I know. I'm still enjoying myself, right?
Yes, right. That's the yeah best way to enjoy life.
Yes. So I am pro happiness.
You're
Okay.
like just my former teacher. She was a 26, 7.
Mhm.
Yeah,
Mhm.
she enjoyed her single life.
Yeah, we should, right?
Yeah, you
Actually,
should. Yeah,
you shouldn't. You're not single, okay?
yeah. But yeah, but I'm okay. I am married at
Okay.
yes, 33, so I
Okay.
enjoyed enough.
Very good. Okay.
Yeah,
So take care of your children, okay?
yeah.
All right.
Okay.
Well, anyway, our time is up, Taebong. Thank
Yeah,
you for your time today, and let us talk again
yeah,
soon. Oh,
yeah.
and by the way, before I let you go,
Yeah.
please vote, okay? Please vote for us here.
Ah, the video. Hello.